This oral suspension of chlorothiazide 250 mg per 5 ml is used to treat high blood pressure, which helps to prevent strokes, heart attacks, and kidney problems. It works as a water pill, diuretic, to make you produce more urine, helping your body get rid of extra salt and water. It is also used to decrease swelling, edema, caused by conditions such as cancer, heart failure, liver disease, and kidney disease. This medication can help your kidneys work better and lessen symptoms such as trouble breathing and swelling in your ankles, feet, hands, or belly. The recommended daily dosage and optimal timing for taking this medication should be discussed with your healthcare provider. When taking chlorothiazide 250 mg per 5 ml oral suspension, it's important to follow your doctor's instructions. Usually, it's taken once or twice a day, with or without food. If taken too close to bedtime, it may cause you to wake up to urinate, so it's best to take it at least 4 hours before bedtime. If you're using the liquid form, be sure to measure the dose carefully with a special measuring device and shake the bottle well before each dose. The dosage will be determined by your medical condition, response to treatment, age, and weight. It's important to take this medication regularly at the same time each day to get the most benefit from it. Even if you start feeling well, continue taking it as prescribed. It's also important to note that cholestyramine and cholesterol can decrease the absorption of chlorothiazide, so if you're taking these drugs, be sure to take them at least 4 hours before or after taking chlorothiazide. If you don't see an improvement in your condition or if it gets worse, such as your blood pressure remaining high or increasing, be sure to inform your doctor. As your body gets used to the medication, you may experience dizziness, lightheadedness, headache, blurred vision, loss of appetite, stomach upset, diarrhea, or constipation. You may also notice a decrease in sexual ability. If any of these effects persist or worsen, notify your doctor or pharmacist right away. To reduce the risk of dizziness and lightheadedness, make sure to get up slowly when getting up from a sitting or lying position. It's important to remember that this medication has been prescribed to you because your doctor has determined that the benefits outweigh the risks of potential side effects. Many people using this medication do not experience serious side effects. Chlorothiazide 250 mg per 5 ml oral suspension can lead to dehydration and electrolyte imbalance. Be sure to inform your doctor immediately if you experience any symptoms such as confusion, unusual dry mouth or thirst, fast or irregular heartbeat, severe dizziness or lightheadedness, or seizures. Notify your doctor right away if you experience any serious side effects, including signs of liver problems, signs of infection, joint pain, numbness or tingling of the arms or legs, easy bruising or bleeding, unusual tiredness, or signs of kidney problems. Seek medical help immediately if you experience a decrease in vision or eye pain. Although very rare, if you notice any symptoms of a serious allergic reaction, such as rash, itching or swelling, severe dizziness, or trouble breathing, seek medical assistance right away. This is not a complete list of possible side effects, so if you notice any other effects, be sure to contact your doctor or pharmacist. If you are in the US, you can call your doctor for medical advice about side effects or report them to the FDA. In Canada, you can call your doctor for advice or report side effects to Health Canada. If you have any allergies to chlorothiazide or other medications, make sure to let your doctor or pharmacist know before taking this medication. Also, be sure to inform them of your medical history, especially if you have kidney disease, liver disease, untreated salt/mineral imbalance, dehydration, gout, lupus, recent nerve surgery, diabetes, or if you are pregnant or breastfeeding. Chlorothiazide may affect your blood sugar, so if you have diabetes, be sure to monitor your blood sugar levels regularly and inform your doctor of any changes. This medication can also make you dizzy or affect your vision, so avoid driving or using heavy machinery until you know how it affects you. Additionally, be cautious with alcohol or marijuana use while taking chlorothiazide. Severe sweating, diarrhea, or vomiting can increase the risk for dehydration, so be sure to stay hydrated and report any prolonged episodes to your doctor. This medication may also decrease your potassium levels, so talk to your doctor about potassium-rich foods or supplements. Chlorothiazide can make you more sensitive to the sun, so be sure to limit your time in the sun and use sunscreen and protective clothing. Before any surgery, inform your doctor or dentist of all the medications you are taking. Older adults may be more sensitive to the side effects of this medication, especially dizziness. If you are pregnant or breastfeeding, discuss the risks and benefits with your doctor before using chlorothiazide. It's important to be aware that chlorothiazide 250 mg per 5 ml oral suspension may interact with other medications, which can affect how it works or increase the risk of serious side effects. It's important to keep a list of all the products you use and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with this drug are dofetilide, lithium. Additionally, some products may contain ingredients that could raise your blood pressure or worsen your swelling. It's important to inform your pharmacist about all the products you are using, and ask how to use them safely, especially cough and cold products, diet aids, or NSAIDs such as ibuprofen/naproxen. This product may also interfere with certain lab tests, so it's important to make sure lab personnel and all your doctors know that you are using this drug. When taking this medication, it's important to consider these potential interactions and communicate with your healthcare team to ensure safe and effective use. If someone has taken too much chlorothiazide 250 mg per 5 ml oral suspension and is experiencing serious symptoms like passing out or having trouble breathing, it is important to seek immediate medical help by calling 911 or contacting a poison control center. In the U.S., residents can call their local poison control center at 1-800-222-1222, while Canadian residents can call a provincial poison control center. Symptoms of overdose may include severe dizziness, severe weakness, and fainting. It is crucial to seek help as soon as possible in case of an overdose. Remember not to share this medication with others. In addition to taking this medication, making lifestyle changes like exercising, quitting smoking, and following a low cholesterol/low-fat diet can help it work better. It's best to consult your doctor for more details on how to make these changes. While taking this medication, you may need to undergo lab and/or medical tests, such as checking your potassium levels and kidney function. It's important to attend all your medical and lab appointments and consult your doctor for more details. It's also essential to have your blood pressure checked regularly while taking this medication. You can learn how to monitor your own blood pressure at home and share the results with your doctor to ensure it's working effectively for you. If you forget to take a dose, take it as soon as you remember. If it is almost time for your next dose, just skip the missed dose and take your next one at the regular time. Do not take double the dose to make up for the missed one. It's important to store chlorothiazide 250 mg per 5 ml oral suspension at room temperature, away from light and moisture. It should not be stored in the bathroom, and the liquid form should not be frozen. Be sure to keep all medications away from children and pets. When it comes to getting rid of this medication, it's important not to flush it down the toilet or pour it into a drain unless instructed to do so. Instead, properly discard the product when it is expired or no longer needed. You can consult your pharmacist or local waste disposal company for guidance on how to do this. If you need more help, call your doctor for medical advice. In the U.S., you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.